as a black person, and I'm sure to all well-thinking individuals and institutions that subscribe to the view that all human beings are born free and equal in dignity and rights. Personally, I am horrified and saddened by what I saw captured on video, and while I join other world leaders in condemning this and other human rights injustices, I'm also very sensitive and extremely concerned by similar injustices here in Jamaica. Our Constitution and our Charter of Rights guarantees the right to life, liberty, and security of the person, and the right not to be deprived thereof except in the execution of a sentence of a court. The Charter makes it clear that the state has an obligation to promote universal respect for and observance of human rights and freedoms. Within the general scheme of our Constitution, therefore, government is not merely a passive observer of fundamental rights and freedoms. Government, its organs and agents, have a duty not to take life or deprive anyone of their rights and freedoms. Our country has gone through decades of struggle to develop transparent and effective systems to address the treatment of citizens by the state, including incidents where life is taken. While we can never declare victory or assume that every agent, functionary, or employee of the government understands and faithfully uses their authority in accordance with the Charter, my government is committed to ensuring that where breaches occur, we will follow due process and thoroughly investigate so that justice is served. We are making progress. For example, in 2019, Indicom reported the lowest police killings in more than 20 years. And you will see that graph on your screen, 86 compared to 137 in the previous year. Several questionable cases of death alleging state involvement have been brought to public prominence, including the case of Jody and Ferron, which we are investigating, and then the case of Susan Bogle, a very sad case, which I had occasion to visit and speak to her son, the conversation that I had with him was one that was very touching. He wanted to ensure that his mother's death was not ignored or neglected by the state, that due process and justice would be done. And indeed, the circumstances surrounding that case where he himself trying to be done. And indeed, the circumstances surrounding that case where he himself, a trying young man, has to treat with 3 dependents who are otherwise abled. It's a really touching circumstance, and for him to maintain a positive outlook, it is an example for all that even in the depths of despair, even if it appears that an injustice is visibly done to you, that you can protest peacefully, and that there does not have to be a resort to violence, a resort to revenge, which sometimes happens to be the case in these circumstances where families and individuals are so hurt they can't let go and they seek revenge. So my interaction with this young man, I thought was very instructive, and I wish to use him as an example of a Jamaican who has suffered loss, but who is treating with it in the appropriate way. I know he's being assisted by many other Jamaicans who are supporting him, and I have offered my support to him as well, and reassurance. I had discussions with the Commissioner of Police and with the Chief of Defence Staff to ensure that there is full cooperation, full compliance, that there is no cover-up or any intention like that. And I wish to say that in my interactions with both the Commissioner of Police and the Chief of Defence Staff, they are the chief agents of fulfilling not just the letter, but the spirit of the Charter of Rights in protecting the rights, freedoms, and lives of every single Jamaican. And then earlier this week was brought to my attention the death of Mr. Noel Chambers while in custody within the Tower Street Adult Correctional Center. And that is both tragic and heartbreaking. And I would like to express my sincere condolences to his family. This tragedy is undoubtedly ranked amongst the most dreadful inheritances of a penal and judicial system that are in urgent need of reform. The Minister of National Security has commissioned a comprehensive audit into the circumstances leading up to Mr. Chambers' passing. A key component of this audit will be a detailed multi-agency examination of the loopholes that may exist across the systems in order to ensure that we remedy any likelihood of this situation repeating itself. This unfortunate situation must result in a complete and comprehensive overview and overhauling of the system to treat with custodies in general and those with underlying mental and physiological conditions. The review process of the correctional services had commenced in the financial year 2018-2019 and included the current Commission of Corrections. The current Commission of Corrections, forgive me, Lieutenant Colonel Rowe, who has been leading the process of institutional review and reform. Substantial investment has also been made in the correctional facilities. In the last financial year, we already invested in excess of 300 million Jamaican dollars. This year, the expectation was that we would have invested upwards of $500 million. But then, of course, COVID happened, and we have had to, unfortunately, cut our budget. Nevertheless, it is my position that no one should be lost in the penal system, and certainly that anyone who has served more than 35 years should be considered for release. I now turn to the COVID pandemic and how we are treating with this. The Permanent Secretary and CMO are here with me. Minister Tufton is on his way, but he is doing some work in Montego Bay and is a little bit delayed. But I'm sure that between PS Brand and our CMO, that all matters can be addressed, including the most recent figures, which I don't have. I suspect you have those figures now. So maybe then what would be useful, CMO or PS, is if you could give those current figures now, the new additions.
Thank you, Prime Minister. Ministers, colleagues all, ladies and gentlemen, good evening. Jamaica has recorded 17 more recoveries in the last 24 hours. This brings the total number of patients who have recovered from COVID-19 and have been released from isolation to 385. The country's recovery rate now then stands at 64.7%. In the meantime, 4 new samples have tested positive for COVID-19, bringing the country's total confirmed cases to 595. All 4 confirmed cases are imported and include 3 males and 1 female with age ranging from 35 to 46 years. 3 of these persons have addresses with residence in St. Anne and 1 with residence in Trelawney. All 4 had returned on cruise ships, 3 from Adventure of the Seas and 1 from MS Marina as part of Jamaica's controlled reentry program. Jamaica now has 96 imported cases, 217 cases that are contacts of confirmed cases, 27 locally transmitted cases not epidemiologically linked, 235 cases linked to the workplace cluster, and 20 cases that are under investigation. Some 341 or 57% of all confirmed cases are females, and 254 or 43% are males, with age ranging from 2 months to 87 years. There are 200 or 34% active cases currently under observation, with 2 persons critically ill and no person with moderate illness from COVID-19. Prime Minister, thank you.
Thank you very much, P.S. Bryan. So I'm going to display my usual graphs. So you would have heard the updates that we now have 4 new cases, but between the 10th of March to about the 13th of April, we had 73 new cases, just the historical context. And then we had a cluster outbreak, which we got under control somewhere about the 2nd of May, which moved our numbers up to 463 cases, which approximated a 6-day doubling, which would be the definition of exponential growth. And then we got back onto our recovery path, which we considered to be the similar trajectory that we were on between the 10th of March to the 13th of April. And so today, with the 4 additional new cases, we would have been at 595, right, P.S. Bryan? Good. Just for reference, we always show what the path would have been without the cluster outbreak. And today, we would have been roughly about 256 cases instead of 595 cases. Now, outbreaks can happen for any reasons, and this is not about casting blame, but this is about registering in the minds of Jamaicans just how precarious the control of the virus can be. There is no certainty, and anything could happen and likely to happen if each individual does not faithfully and consistently follow the various orders and measures and protocols and recommendations that we always stress in these press conferences: wearing masks, hand sanitizing, social distancing, following the curfew orders. And I'm sure by now all Jamaicans would know what these protocols are. But how are we progressing? I mean, we've focused heavily in the media on the overall numbers, but that is not the entirety of how the management of the epidemic is progressing. Unfortunately, we have added, since I believe it was yesterday, P.S. Bryan, yesterday or the day before? Yesterday, 1 additional death. which is very unfortunate. I gather it was of an elderly lady, 84 years old, 87 years old. And my condolences and sympathies to her family. But we have good news as well, in that our recoveries are increasing. And if that could be shown. And that's the green line, and that has been steadily increasing. And our recoveries have a very high level of certainty, CMO, because we do 2 tests before we declare anyone as being recovered. And so with how many added, PS? 14? 14. 17 new recoveries, which would have brought us up now to 385. So this is the graph as of yesterday. So we are now up to 385. And then let's look at the active cases. And that is the blue line that shows number of active cases. And that is the number of persons who still have the virus in sufficient load, and we still consider them a risk of spreading the disease. So our recovery rate is now PS up to 67%, which is very good. Which is very good. I wanted to look a little bit now on projections. Of course, we now have more recovered cases than active cases, which is a good sign. So at 595 cases, we are, if we continue on this path, CMO, we, at the end of June, at this rate, could be at 695 cases. And this is just a best fit line saying what the cases could be if the best fit line holds. How does the best fit line hold? If every single Jamaican follow the protocols, wear their mask, hand sanitize, maintain social distance, the numbers could even be less. However, in the coming days, we will be increasing the number of Jamaicans we are repatriating. And based upon what we have seen in the repatriation exercise so far, where we have repatriated approximately 2,300 persons under the controlled reentry program, and all of them have been tested. We have had 58 imported cases so far. This represents a positivity rate of about 2.5%. The brown line, the brown dashed line, shows how our existing trend is likely to be affected with the planned re-entry of approximately 10,000 persons between now and the end of June. So we are hoping that we could do 3,000 persons between now and the 14th. And then we are estimating that based upon the number of persons who have applied and other non-Jamaicans who may want to enter, then there would be likely another 7,000. So potentially, we could expect an assessment of risk that our numbers could rise to this amount. It doesn't have to be. It can be less. Again, it all depends on whether or not the persons who re-enter follow the sensitization, follow the quarantine orders, follow the stay-at-home orders. It really depends now on how we exercise personal responsibility. I would now like to provide an update on the controlled reentry program. Since the last press briefing on May 31st, we have had a flight from Cayman, and that was yesterday, with 78 Jamaicans. We have had a JetBlue flight today from New York with 69 Jamaicans. We have had an Air Canada flight today from Toronto with 14 Jamaicans. So this brings the total number of Jamaicans who have returned under the program of controlled reentry to approximately 2,500 so far. As a result of feedback that we have been receiving, we have simplified the Gov't application process to have only one stage of approval. We previously had a two-stage approval process with a conditional approval and then a final approval. Therefore, anyone that was previously conditionally approved will automatically receive their travel authorization. The travel authorization is required in order for you to book your flight and also to be allowed to board the flight. Now let me give you the latest numbers from the Gov't system. We now have 4,100 applications that have been approved. These persons are now able to book any available flights and return to Jamaica. We have 1,472 applications that are currently under review by the health and immigration authorities, and those should be approved within the next 48 hours if all is in order. However, there are 2,729 applications for which we are awaiting the home quarantine assessment questions to be answered. We have sent out multiple email reminders asking for this information, and I am making a special appeal to those persons to provide it as soon as possible. The health and immigration authorities are not able to process your application without this information. We are working with the airlines to get flights scheduled as soon as possible. We have advised the airlines that we have the capacity to take up to 6 flights a day, 3 at each airport, 1 flight per day from the Caribbean and 2 flights from North America or elsewhere, 1 in the morning and another in the evening. We have already scheduled flights expected to bring in approximately 970 Jamaicans. As I announced at the last press briefing and also in Parliament earlier this week, we have introduced new risk-based protocols for controlled re-entry for the period June 1 to 14th. I will now walk through these new protocols using slides that that you should be seeing now on your screen. Firstly, we have introduced a travel bubble concept comprising low-risk countries based on a risk assessment of countries from which persons who are seeking to enter Jamaica and the travel routes that they will take. We have evaluated specific criteria which includes similar management and profile results for the epidemic regarding spread, death rate, infection prevention and control measures, contact tracing protocols, and other criteria. The list of countries comprising the travel bubble will be constantly reviewed and evaluated, and currently includes Antigua and Barbuda, the Bahamas, Barbados, the Cayman Islands, Grenada, Montserrat, St. Lucia, St. Kitts and Nevis, St. Vincent and the Grenadines, Trinidad and Tobago, and the Turks and Caicos Islands. So, effective June 1, all persons arriving in Jamaica, whether from countries within or outside the travel bubble, will be subject to a health screening and risk assessment by the health authorities. The health screening will include checking temperatures, observation of symptoms, as well as an interview by a health officer. The health authorities will make a risk assessment based on information obtained through this health screening, as well as consideration of other factors. And these factors could include the country and city of origin, the travel history, the travel route, and the living conditions at home where applicable. The risk assessment will determine the testing and quarantine requirements. All persons will also be required to go through a sensitization that will advise them of the various infection prevention protocols within Jamaica, such as hand sanitizing and hand washing, wearing masks, social distancing, gathering restrictions, and curfew hours. I will now walk through some slides that will illustrate the protocols applicable for the period June 1 to 14 for the travel bubble countries as well as countries outside the travel bubble. Now, the first slide shows the protocol for the travel bubble countries. Persons not considered to be high risk as a result of the risk assessment will not need to be tested and can go home. They will be subject to stay-at-home orders, which means that they would be allowed to leave their homes only once per day for the necessities of life, obtaining food, medical supplies and service, conducting financial transactions, quick oversight of their business, and attending a place of worship and exercise. Persons who are assessed to be high risk, however, would be required to be tested. Given that they are coming from the travel bubble, that is low-risk countries, a likely reason for being assessed as high risk would be that they may be showing symptoms. As a result, they would need to be quarantined either at home or in a government facility as required by the health authorities to await the results of their test. If their test is negative, they would remain under either a stay-at-home order or a home quarantine order as determined by the health authorities for 14 days. However, if the test is positive, they would go into isolation either at home or in a government facility as determined by the health authority. Now, the next slide shows the protocol for countries outside the travel bubble. In this case, in addition to the health screening, risk assessment, and sensitization, all persons would need to be tested. Persons would then go home and await their test results. Persons assessed to be low risk would be released under stay-at-home orders, while persons assessed as high risk would be under home quarantine orders. Unlike stay-at-home orders, persons under quarantine orders are not allowed to leave home without the permission of the health authorities. If the test is positive, they would go into isolation either at home or in a government facility as determined by the health authorities. If the test is negative, they would be under stay-at-home orders if assessed as low risk, and either stay-at-home orders or quarantine orders if assessed as high risk. Now, effective June 15, we will also allow non-nationals to enter. We will then have three categories of travelers. Category 1, that is our Jamaican nationals, and there are non-nationals who are ordinarily resident in Jamaica by virtue of a work permit, marriage, or being the dependent of a national. And then category 2 would be non-nationals visiting for the purpose of a vacation for tourism. And then 3, non-nationals who are considered to be business travelers. So the next slide shows the protocols for Jamaican nationals and non-nationals ordinarily resident here. These protocols are virtually identical to the protocols described earlier for travelers coming from bubble countries. The slide now displayed shows the protocols for tourists. These protocols are also similar to those for Jamaican nationals, except that tourists will be subject to a stay-in-zone order. That is a geographical area which will be called the COVID-19 resilience corridor. And this will be defined within which, this is a defined area, within which tourists would be required to remain. The final slide shows the protocols for business travelers, non-Jamaican business travelers coming to Jamaica for less than 14 days would be required to be tested on arrival. They would then be subject to quarantine orders at their hotel while they await their test results. If the test is positive, they would go into quarantine, into isolation rather, either at the hotel or in a government facility as determined by the health authorities. If the test is negative, they could proceed to conduct their business and meetings as planned. And of course, they would have to leave the island within the time that they have been allotted by immigration. Now, I want to speak generally about some measures that we have put in place. Now, since the last press conference and my statement in Parliament, there are a few specific measures which we have now gazetted, and that is the Work Smart, Work Safe order. The category of persons who may need to work from home has been expanded to include persons who need to care for someone with a disability. Previously, we had only included persons who had to stay at home to take care of children or elderly. We are now putting in place this new category of persons who have to stay at home to take care of someone who is otherwise able. Now, the controlled re-entry of Jamaicans, I would have updated on the controlled re-entry in detail earlier, and Minister Bartlett would also do a presentation. Let me note that we now have made explicit provisions for spouses and dependents of a citizen of Jamaica to travel to Jamaica, which would, we have seen the case in the papers recently where a Jamaican with a spouse of another country were separated because their control orders did not make such provisions. And sometimes when we think of Jamaicans, we tend to only want to think of persons who hold Jamaican passports. The concept of a Jamaican is very broad. We have over 1.5 million Jamaicans in North America and within the Caribbean basin. And many of them, though they may not have gone through the process of actually getting citizenship, they consider Jamaica their home. Many of them are married to Jamaicans. Many of them have children here. They have houses here. They have businesses here. Many of them were born or were children of Jamaicans, born in, let's say, the United States. They may have gone up before the pandemic for vacation or to visit family, but their parents are here. There might be young children needing to come back to their parents here, and there are many cases like that. So there is a sense in the country that when we say we open to non-nationals, we are only opening to tourists. And I wished Jamaicans to appreciate that, unlike the other CARICOM countries where the diaspora may not be as significant, our diaspora is significant. And indeed, we have many non-nationals who have made Jamaica their home as well. And they are Jamaican by everything except that they have not gone through the process of getting their passports. And I'm certain that if you look hard around your community and with your family, you will see that there are many such persons. So in terms of bringing back our Jamaicans, we are bringing back our Jamaicans who are Jamaican nationals, and we are also bringing back those who may not be citizens, but who have, some have work permits, some have long stay, some have children here, some have businesses, some have homes, and they will come back as well. Well, as I've said before, we have made provisions for business travel and for vacation travel. Now, some other measures. Now, in keeping with the measures to gradually reopen the economy, there are other incremental steps being taken. Minister Mackenzie will come to the podium very shortly to tell us about the deliberations that we have had in terms of allowing access to beaches and rivers at specific times with very specific guidelines and control measures. And this will be in effect from Sunday, June 7, 2020 to June 30, 2020. Many requests to look at weddings, and that's another incremental step. So in terms of modifications to that order, the attendance at weddings, which will take effect also on Sunday, June 7, 2020, subject to social distancing and other health protocols at the selected venues, including a place of worship, a maximum of 50 persons will be able to attend a wedding. If the venue can only hold 30 persons, taking into account the social distancing requirement, then only 30 persons can attend. Let me just quickly make sure that what I've just said is well understood. The order will have in place the requirement for a physical distancing rule, meaning the number of persons in the space to square footage, 1 person to 36 square feet, which would give you the ability in terms of the functional space to maintain social distance, that if you stand in the square of 36 in the center, then you should have 3 feet apart. The other person standing in the other square should have 3 feet apart between both squares. From the center, you should have your 6 feet apart. So if your space can only accommodate 30 people with that physical distance requirement, then it is only 30 persons. If your space can take 1,000 persons, there is a cap, only 50. Now, in Parliament, the parliamentarians maintain that you can't enforce the social distancing rule on the bride and groom. But we are enforcing that rule on everyone else. So we have changed the requirement, but again, it is now dependent on how the persons who are going to attend the wedding treat this relaxed requirement. I can only urge them to continue to practice the social distancing. We haven't said that you must wear a mask, but I don't think I need to say it. Even at the wedding, I see some very fashionable masks being worn. They can be incorporated into the wedding styles. We're not asking that be imposed on the bride and groom or the bridal party, of course, but we're still asking that everyone who is attending maintain the orders. It is for your own benefit. All right. There are other orders as well that we will adjust. One of them is with respect to funerals. As of Sunday, June 7, 2020, where a funeral service is being held, subject to social distancing and other health protocols, a maximum of 50 persons will be able to attend. If the venue can only hold 30 persons, for example, taking into account the social distancing requirement, then only 30 persons can attend. Again, just for clarity, just as I've explained it for the weddings, even if the facility, by virtue of the physical distancing, that is the person to square footage, 1 person to 36 square feet, even if the facility, by virtue of that, could hold 100 persons for the funeral service, only 50 should be at the service. And let me just be clear, this is for the funeral service. This is not for the burial. So this is a funeral service alone. So note as well that the maximum of 15, of which no more than 10 may be mourners, has not been changed for burials. So for burials, that is at the graveside. And I've been getting, as I've said, many complaints We have gotten complaints about large funerals as well. The police commissioner is here. He can attest that I have raised this matter at National Security Council, that I know that, you know, some policemen, some officers in charge of stations, sometimes they get frustrated, sometimes they just can't, you know, they're overwhelmed. And so some of these funerals might slip through. But I'm saying, Commissioner, that you have to intensify the enforcement of these orders, especially on funerals. I hope that weddings don't give you any problems. So, just to be clear, notwithstanding the specific social distancing measures for places of worship, the square footage, as I've said before, and for funerals, the square footage rule, that is the number of persons to 36 square feet within any space, that is determining what your maximum capacity of any facility, but there is a cap of no more than 50. And we'll ask Minister Mackenzie to, when he's speaking, to say a bit more on any of those protocols. So, we cannot overemphasize the need for every Jamaican to take personal responsibility in the choices they make to secure their safety and the safety of others. Whereas based on your immune system and health status, you may be fine if you contract the virus. People who you know may succumb to it, and we have to do all that we can to protect each other. Ladies and gentlemen, I thank you. I now invite Minister Bartlett to give us a presentation on the health protocols, the preparedness of the tourism sector with those health protocols, to tell us a little bit more about the resilience corridor and how that stay-in-zone order will be enforced, and most importantly, what we will be doing to protect the workers. Minister Bartlett.
Thank you, Prime Minister. The reopening of the tourism industry is required for the Jamaican economy and especially the Jamaican workers. Our economy stands to lose more than $145 billion for this year if tourism is not reopened. $35 billion for the public sector and $107 billion for the industry itself. And if we do the math on a daily basis, we're talking about $400 million lost per day. There are 350,000 workers involved in the tourism sector. And those workers need to work. They need income. And importantly, a survey was done of some 8,000 of those workers, and it indicated that 93% of the tourism workers we surveyed want or need to return to work. In addition to those in the tourism sector, we must remember our industries with linkages to several other industries around. And the workers across all of these industries benefit from the reopening of tourism. Some people may not think that the banks and our insurance companies and several others are within the tourism ecosystem, but indeed they are. And the implications for workers in all these areas are very stark and very palpable. It is based on these facts and more that we have decided to reopen our borders to tourism. However, we are committed to reopening in a safe and controlled manner to protect our most treasured asset, our people. We have developed several tools to protect our workers. I will quickly share just 4 big areas of the many. The first line of protection we have put in place is a resilience corridor for tourism travel. Tourist movement in this area will be controlled, and they will not be allowed to leave the corridor. You will notice that the corridor essentially moves from Negril along the main road areas, east-northeast, along that highway all the way to Port Antonio, so that all the properties on the windward side, or the beach side, so to speak, would be embraced in that corridor. Businesses within the corridor will go through extensive training and will not be allowed to open until they have been assessed by TPDCO, which will happen in a phased manner. I'll talk more about that in a moment. The corridor is designed to keep the workers and our country safe by only opening an area in which we have the capacity to train, oversee, and manage. And every effort is being made to ensure that this is what we call a managed space, so that we can track and trace, and also we'll be able to have ready access to whatever security and other measures that are needed, communication measures also, to ensure control. To guide businesses that are reopening, we have designed detailed operating protocols for each segment of the industry, and it's contained in this document, which tonight, having had some extra work done today with the Ministry of Health and the airports and the aviation group, we will have this on the website as of tonight, after we have made all the additions and corrections as per the meetings we had today. So we have left nothing for chance here. From training to supplies to procedures, everything is covered in this document. In fact, the World Travel and Tourism Council, a global leader in the tourism industry, has reviewed and endorsed our protocol with their stamp of approval. And we have been able to just insert the stamp right here so that that's visible also. The protocols consider the worker in every activity they are meant to undertake in performing their functions. It provides guidance for the moment they arrive to the time they return home, all to ensure every risk that can be managed is being managed at all times. In slide 4, as you would see, to drive compliance with these protocols, the Tourism Product Development Company will play a leading role. And I want to pause to pay tribute to the TPDCO at this time for the sterling work that they have done, along with some team of advisors in putting together this very, very detailed protocol that is going to be made available for the use of the industry. We have increased the staff complement of the TPDCO's Product Quality Control Department from 11 to 77 to ensure they have the proper capacity to take on this work in the prescribed areas. The ministry commenced training during this period, and indeed during the period when the closure was effected from March 10 on to today, some 5,000 tourism workers have completed training in a number of key skilled areas. And perhaps just for your knowledge, we are pleased to advise that 2,930 persons have completed certificates in the SERV safe courses. And I think the Ministry of Health would be interested in that. They serve safe, because that has a lot to do with the sanitation and the health protocols in particular, and to be more conversant with that. 55 candidates are successfully completed the Certified Restaurant Service course, another area where much of these protocols are involved. 2 groups totaling 192 started training on the 1st of June under the HEART program, and then an additional 1,250 persons are also training in this critical area by HEART. We expect that more than 1,000 will complete their certification by today, and then the others will be completed in another 2 weeks. The first cohort of the online certified hospitality supervisors completed their examination on Friday, the 29th of June in Montego Bay, Runaway Bay, and Kingston, and 16 of the 19 candidates were successful. A second cohort is expected to begin on Monday, the 6th of July, 2020. In collaboration with the University of the West Indies Open Campus, our Jamaica Center for Tourism Innovation offered introductory Spanish classes, which started May 11th, and 220 persons were enrolled. In collaboration with the Jamaica Hotel and Tourist Association, the UWI Law Faculty and the JCTI offered a new course called Tourism and Law, which began on Tuesday, the 2nd of June, and 62 persons have enrolled in that from the industry. We have ensured that all categories of workers, those both who are in furlough as well as those who are laid off, have had access to training in one area or another in preparation for during COVID activities and hopefully post-COVID activities. The next TPDCO will commence a training program now for all workers starting this weekend at the Convention Center. Training will provide detailed information on how to apply the protocols, as well as the hands-on practice and role plays. And a couple of days ago, we did a tour of a number of facilities just to see how some of the workers were being trained and prepared on site and in some of the hotels, as well as to manage open areas and to understand what social distances or physical distancing, as we say, is, and a number of the other protocols. I want to ensure that all our workers know exactly what they need to do, how to respond to the variety of different situations that they will encounter, and most importantly, I want them to be trained not just in their ordinary skills, but also in the skills of communicating and supporting emotional activities and developments that may happen around them while they are at work. As a next step, each business will be assessed by TPDCO to ensure they are compliant with the protocols and that the workers have been trained before they are allowed to open. If the assessment is successful by the TPDCO, they will receive a certificate, which I'm sure you're seeing on screen. And they will receive that certificate, which must be displayed properly in their establishment to indicate that their business is TPDCO protocol compliant. It is important to recognize that the support will not stop once the assessment is complete. The workers will receive ongoing training and the comfort of knowing the businesses that they are involved in, while we monitor and ensure that there is ongoing compliance on the part of all. An element of protection we think that is very critical is to be prepared for response. I think it is critical to be prepared for the risk that we may encounter a COVID-19 positive case. So the worker must know also how to respond and respond quickly. All workers will have access to an on-site trained COVID-19 safety point person and an on-site or on-call medical professional. This combination of resources will provide workers with the resources they need for quick health consultation, isolation, and testing if required. In addition, we are in a final stage discussion now with insurance and global logistics providers. I want to make the point that we have done checks around, and Jamaica is the only country, absolutely in the Caribbean and arguably in the Americas, that has taken on this responsibility now to begin those negotiations and discussions with insurance and global logistics providers. And they will also enable travelers who test positive to be quickly isolated and repatriated. I met one of those groups in London a few years ago when we launched the first and only Global Tourism Resilience and Crisis Management Center here at the University of the West Indies. And when we met that particular group, they were very anxious to come and participate with us in the resilience development exercises, particularly because they were working in Haiti after the earthquake. And among the many things they do is to provide quick response to remove distress situations and to deal with medical emergencies. And we're very pleased that they are in consultation and discussions with us now, looking at a program that will enable a low-cost coverage for visitors who come to the country. And without trying to give the full figure, but I can assure you it will be less than $20 per person for that coverage, which will allow them to be rescued and repatriated once there is a positive case of COVID-19 in Jamaica. So this will help to reduce the strain on our public health system, making sure healthcare capacities that we know we have is consistent for our workers and for our communities. I have indicated these measures, which I believe are also among the first of its type, because when we sent these measures to the World Tourism and Travel Council, they immediately came back and said that of all the protocols that they have looked at, Jamaica is the best and most robust of them all. We just want to emphasize that this Andrew Holness government takes the lives of our people seriously. And we will not make any step or do any action in terms of building and securing the livelihood without full cognizance of the need to secure the lives of our people. I thank you.
Thank you for that comprehensive presentation, Minister Bartlett. I now invite Minister Mackenzie to come and give us an overview of the measures that are being supervised by the Ministry of Local Government and Community Development. And then after that, I will call on Minister Vaz to tell us how the BPO sector is faring under certain measures that we had put in place. Minister Mackenzie.
Thank you, Prime Minister. quickly. I won't be as long as my colleague, Minister Bartlett. But you have already indicated, Prime Minister, with effect as of Sunday, all public beaches that are licensed under the Beach Control Act or otherwise will open from 6 a.m. in the morning to 6 p.m. in the evening. There are certain measures that have been outlined that we will be putting out in the public domain, which would include the social distancing, which has been already indicated in many of what we are doing, the wearing of masks, and we are emphasizing a family-oriented grouping in the beach setting. We would like to see families and groups consisting of 2 persons gathering within a certain distance as prescribed in the order, no more than 10 persons at any time shall gather in any one area of the beach. The operators of these locations will not be permitted to provide any form of seating, but persons visiting the beach would be allowed to take their own personal chairs. The activities will be limited only to swimming, and there can be some jogging on the beach, but there is no provisions in the order for any social activities. So there shall be no beach party. So it is just for swimming and jogging, and we are restricting these activities, which also include football, volleyball, dominoes, etc. Those activities will not be permitted during the operating hours of the beach. There shall be no seating for dining at the establishment. The operators are asked to provide the necessary facility to facilitate staff and customers. The social distancing requirement that is set out in the law will be applied. Vendors shall not be permitted to walk the beach with items for sale. So the operators of the beach must make the necessary arrangements for persons who want to provide that service. Bathroom facilities will be strictly enforced using the protocols that is outlined by the Ministry of Health. And I would like to indicate that we will be monitoring the operation of the beaches to ensure that we get compliance within the order. Remember, this is for a 14-day period, and at the end of the 14 days, we will review those activities. We have also, Prime Minister and colleagues, extend the order to cover rivers, and the operating hours is between 6 to 8 p.m. and it is done because rivers at times substitute for beaches, and we are putting in the same guideline and conditions, but there are some concessions that will be made for the allowing of fishing and we have even also included a provision for crossing the river, because there are going to be times when people have to access certain communities that they have to cross the river. So we have also included that, Prime Minister, in the order. And again, there will be no river parties. It is strictly for the purpose of domestic use, because most of the rivers are used for catching water, washing, fishing, and crossing. So, Prime Minister and colleagues, the reopening of these facilities will be done on a phased basis and will be reviewed at the end of it. I want to emphasize that the orders that was extended as it relates to sport bars and places of amusement, nightclubs, is still in force. And this order also does not give the right for any water attractions to be open. So all water attractions will remain closed. They are not permitted to be open under this existing order.
Thank you, Minister Mackenzie. Just to repeat and re-emphasize that the river is a very important domestic and economic support for many communities. And we have decided to craft the orders so that people aren't in violation of the orders. And so people can use the rivers for their normal use, their domestic use, washing. Many people bathe in the river. People catch water from the river. The rivers separate communities. People have to cross it. However, this is not an order now opening up for partying and other kind of social activities around the river. And we encourage persons who are still using the river to maintain all the necessary protocols. And the same applies for the beaches. Minister Vaz?
Thank you very much, Prime Minister. And on behalf of the people of Portland, we thank you for the rivers. Prime Minister, colleague ministers, I will now give a quick BPO report based on the task force for the reopening of BPOs that the Most Honorable Prime Minister established back in April 2020. And this was to ensure that BPOs that provide essential services could do so during the temporary lockdown, and to ensure that all BPOs were successfully assessed by the Ministry of Health and Wellness, and thereafter reopened using a set of guidelines that were approved by this task force. The guidelines were approved by the task force on May 14th, and thereafter provided to the health inspectors across the island who have been conducting inspections using the following instruments. And Prime Minister, I'd ask you to allow me to commend by acknowledging the Ministry of Health team, which was the most critical team based on the fact that they had to establish workable protocols. And I've said before, Prime Minister, it is almost like fitting a square peg in a round hole, but we did it. Dr. Simone Spence from the Ministry of Health, Dr. Espinosa Campbell, and Mr. Richard Baker from the Environmental Health Unit of the Ministry of Health, Mr. Richard Thompson from OGPEM, who obviously also played a critical role, and of course all the other agencies, state agencies, must be commended for the work that was done. And basically, we had our last meeting just yesterday after having weekly meetings since April. Coming out of the task force, Prime Minister, we created a BPO inspection tool. This has been specially prepared in relation to the COVID-19 pandemic. it seeks to ensure that the conditions are put in place to minimize the risk of transmission in these entities. Just briefly, I'll read out for you some of the measures implemented: the work at home, the increased transportation, which means office to home direct drop-offs, and of course that would include more trips, pre-screening of employees, temperature checks, etc. on entering and leaving the building, social distancing, 6 foot spacing or 6 feet height, plus 1 foot separation, and of course protocols for gatherings. Sanitary and hygiene practices, which obviously hand washing, sanitizing stations, of course regular cleaning of the carpets, environmental ventilation, fresh air intake, recommended use of cleaning materials, and of course, most importantly, the handling of sick persons, reporting, isolating, deep cleaning, and reintegration protocols. Second Prime Minister was a public health institutional form. This is a tool used to assess the general public health conditions existing in the facility. The facility must also be in compliance with both to remain operational. And Prime Minister, I'm pleased to say that after the initial outbreak, we had 4 cases subsequent to that unfortunate outbreak, the last being on May 13th. So we are having an enviable track record so far, but no need or no complacency can we put. The task force successfully discharged its duties by taking the input and contribution of a number of agencies and BPO operators into consideration. That is important, Prime Minister, because it has to be a holistic approach, and if you don't have the buy-in from the BPO operators at the ownership level and the management level, then obviously it's not going to be holistic. And as I said before, Prime Minister, four cases, the last being on May 13th. Just to give you a breakdown, as of May 31st, 2020, the Ministry of Health's report overall summary is as follows. The number of BPO sites inspected, 91. Number of exempt, 59. Number of satisfactory, 68. Number unsatisfactory, 10. And let me just say that those are smaller BPO operators which are still working to meet the new protocols. And out of those 10, Prime Minister, it's about 1,000 workers within those 10. And last but not least, of course, based on COVID, we have 13 that were closed voluntarily. So the non-essential workers began returning to work on May 8th, 2020, and will continue during the course of the next 3 months as sites are reopened. Prime Minister, in December 2019, we had approximately 43,000 employees in the BPO sector. By March 2020, which is just about the time we had the first case of COVID, we had 40,000. So there was a decline in that 3-month period of about 3,000. As a result of the COVID pandemic, we had 7,500 BPO workers who were laid off. And as a result of the protocols, Prime Minister, we have been able to get 3,300 of those 7,500 back into full employment. It is expected that it will take us probably till the end of the year, Prime Minister, to be able to get back to where we were as of March. So as of right now, we have about 35,000 persons employed, and the loss of revenue during the pandemic has been about 42 million United States dollars. So, ladies and gentlemen, you can see the impact of this industry and the reasons why we had to do what we did in the interest of making sure that our Jamaicans were safe, and with the vision of the Prime Minister by setting up this task force and us being able to work assiduously to get the protocols in place. I'm happy to say, Prime Minister, that this would be the last report on the BPO task force. We have a mechanism that if there's an issue that arises, it comes to me and we call a meeting if necessary. But I can say that my job as it relates to this task force, the reopening would have transitioned now into the post-COVID BPO sector, which is a subcommittee of the economic COVID recovery chaired by Minister Clark, Prime Minister. So I look forward to, we'll talk about that, okay.
So just a little bit of context. When the outbreak happened in the BPO space, we took immediate action and we assigned Minister Vaz to pull all the elements together, including health, local government, the other agencies that were involved, including ODPEM. And they have done a fantastic job in putting in the protocols. And just that Jamaicans understand that we didn't just sit by and allow the industry to crash. We didn't just sit by and say, okay, suffocate the industry with protocols. What we did was to see how we could recover better. And I think that Jamaica's BPO industry can be held up as a model as to how to restructure and reconfigure to work smarter and work safer. And that is the idea. The idea is not for us to shrink from the challenge of the pandemic. It is not for us to, in an indefinite period of time, hide in place from the virus. The idea is for us to use our ingenuity, our innovation, the science, the knowledge, the know-how to craft ways of living with the virus. And that, the human race has always been challenged with diseases and viruses. But here we are still. Sometimes they have taken a great toll on us. But if you would ask me when would be the best time to be alive as a human being, it's now. It's when we have the scientific know-how and the knowledge to overcome. And I am confident, I'm 100% confident that we will overcome this virus and our society will get back to our normal way of living, but maybe with new things as part of that normal. So ladies and gentlemen, the Minister of Local Government wants to say that rafting on the river is not allowed. So I said it for him, there's no rafting allowed on the rivers just yet. And all the measures that we have announced, they will either expire on the 14th or on the 30th of June. At the 30th of June, we will review, but make no mistake, if we see any departure from the trajectory that we have outlined earlier when I put up the graph, then we will reinstitute the tighter measures. But we have to start now to move towards recovering, not just from the pandemic, but recovering from the recession. Very interesting as we put information out to the public, that sometimes we take it for granted that the public fully understands what we are saying. So you're going to help me give some information, P.S. Brian. And I'm wearing my mask deliberately because sometimes when I speak on the platform, I see criticism. How am I speaking? I don't have my mask. So they didn't see when I come on, took off my mask. It is possible to speak with your mask on and still be heard properly, depending on the mask you wear. So I was just looking online and seeing some of the questions being asked about the numbers. So P.S. Brian reminded me we are 595, and how many recoveries are there? 385. And how many cases still active? 200. So there are some people who are saying you have 500 new cases plus the 200 still active. People have actually drawn that conclusion. And so we have to be clear, just for clarity, that we have 500 cases overall. If the graphs could be put back up, we have 500 cases overall. Of that 500, how many have recovered? 385 have recovered, leaving 210 that are still active. So in effect, if you ask how many people, 10 deaths, right? Only 200 cases, right? So if you were to ask how many people in Jamaica we can verify still have the virus, it is 200. The rest have recovered. Just thought I'd make that clear. I suspect it is clear on the graph. The blue line shows the active cases declining. That was as of yesterday. The green line showing the recoveries increasing. Ladies and gentlemen, thank you for joining me. We now turn for questions.
Of the media, we ask that you just raise your hand real quickly. The time being 11 minutes to 8 o'clock, we're cognizant of it. So if you could keep your questions really short and let our respondents here have the benefit of answering real quickly to get as many questions in as possible. Do we have any questions online from any member of the media? Okay, let's start off with Ms. Brittany Clark from Nationwide Radio. Brittany?
Hello, good evening, everyone. Okay, so I have two quick questions. I'll start with this one for PN Holness. Mr. Holness, at the beginning of the conference, you would have made a comment that you believe that persons unfit to stand a trial must not serve more than 35 years in prison. So is it possible for you to expound on that point, please? Is this an official directive being issued by you, or are you recommending that the 35 years would be an automatic release point?
So, as Prime Minister, I don't have the luxury to give unofficial positions or to share my thoughts, because every thought that I share becomes formal. Nevertheless, it is not yet an official directive, but I'm signaling my intention. I have passed it through the AG, and I have discussed it with the Minister of National Security. And at Cabinet, I should say that I have asked the Minister of National Security, who is now in the process, and we have with us here the Commissioner of Corrections is here as well. So we have asked for a comprehensive report to be brought to Cabinet, and when that comes to Cabinet, Minister, can we get that for Monday, for Cabinet on Monday? Then I will be making that recommendation. But when I saw the whole thing, my perspective on it is that we should seek to use the 35 years as a cutoff point to ask for reprieve, even if it is just to clear the cases that exist there now.
Okay, I had a follow-up as well, please. This one is for the Health Ministry, actually. The FDA recently authorized the antiviral drug remdesivir, produced by Gilead, for emergency use in the treatment of severe COVID-19 cases. So has the Health Ministry considered ordering and using this drug in the treatment of patients who are moderately or critically ill?
Thank you, Brittany. The Chief Medical Officer, Dr. Jacqueline Bisesa-McKenzie, will respond to that question.
Right. Good evening. All right. So you would know that the FDA has just made that pronouncement, and so it's going to take a little bit of time for us to examine all the material, and of course to find the patients that are going to fit the criteria for the use of the drug. You have been tracking over time the number of moderate to severe ill patients that we have, and you would recognize that there are very, very few persons. So the actual demand for the use of these therapies are not so great here in country, but we will be examining the use of the drug and seeing where it is relevant.
Thank you, Dr. Bisesa-McKenzie. Let's turn over to 18 Greece North. Ms. Burton, could you unmute your microphone for us? We're not hearing you.
Sorry, thanks. Good evening, everybody. All right, so I have a couple of questions this evening.
Recall, Zara, that we asked that because there are so many persons online, if you could just make them really quickly so that they'd be able to get through as quickly as possible.
All right, and Naomi, if you could do me a favor and not cut me off, I'd really appreciate it. All right, so one is how will you ensure social distancing is observed at this weekend's protest? That's one. And perhaps the health minister is there, I don't know, maybe he could answer that one. The second one is, are you going to be putting any restrictions in states, for instance, like New York, for the acceptance of visitors at all? So that's also for the health minister. Also, the other question for the foreign affairs minister is when somebody applies on the COVID-19 app, who are the individuals that make the decision on who gets in? And lastly, this is for the Prime Minister. At the beginning, and I'm really, really sorry if I missed this, but I think you alluded to budget cuts for the Ministry of National Security. I just wanted you to expound on that a little bit and maybe as it extends to other ministers.
Well, on the budget cut, all ministries except the Ministry of Health received significant budget cuts. I don't have the exact figures with me, so I really don't want to quote wrong figures, but the budget was cut significantly. As it relates to national security, there was last year and the year before an infrastructure program that was in train. That infrastructure program had infrastructure to do with security-specific items, but also construction, repair of stations, repair of correctional facilities, and so forth. And this year we have had to cut, and that cut would have gone right across, including cuts to the repair of facilities. And I've raised that just to say that the circumstances under which our elderly gentleman passed on would have started to rectify those conditions within the prisons, but the budget cuts may impact that. So we have to take a relook and see if we could still continue with the program. But at this stage, I couldn't give any guarantees that that would actually be the case. As it relates to us being able to police the advertised demonstration or protest, I think that would be, I'm not certain when I've seen the ad, but when is it that they're proposing? My advice is that we don't want to defeat the very purpose of why we are gathered here, which is to discuss and put in place the measures for the successful handling of the pandemic. Yes, the right to, your freedom of expression and to peaceful protest, we don't want to in any way impact on that. So we ask persons who plan to protest to please be respectful of the orders that are in place. And there is no need to have any confrontation with the police if the police sees it necessary in your own interest to enforce the orders as it relates to social distancing and wearing of masks. It is a difficult time all around for everyone. And there are many Jamaicans who are suffering quietly. Many households have lost their incomes. The investments that we have made in road infrastructure and trying to, fix up our city, we don't want to destroy that. So as we make our point, we should also be conscious of we are in a pandemic and we are also in a very severe economic crisis. I believe the other question was today, or whether or not persons would be tested coming from for example, New York. And the straight answer is yes, and we have to be frank and upfront with that. If you're coming from an area designated as high risk, yes, you would be screened and tested.
Thank you, Mr. Prime Minister. Let's then go over to Mr. Damian Mitchell. Ahead of Mr. Mitchell coming on, there are several questions on social media, sir, pertaining to pools. For example, will the aquatic center be reopened? Will they fall under the beaches and rivers opening?
No. Those are considered to be water attractions and so forth, so no.
All right, there you have it, members of the public. Let's then welcome...
Just to be clear, the logic behind beaches and rivers is that they are an expanse of open space, and that you can gather as a household, as a family, within your family unit, and still maintain social distance. The airflow is fine. In a pool setting, it's not an expanse of space, and it might be very difficult. So pool and water attractions and the like.
Thank you. Let's then go to Damian Mitchell. Mr. Mitchell?
Thank you, Naomi. Prime Minister, I have 3 questions. I'd really appreciate if I can ask 2 and then have you respond to the third. So the first question, I've heard you and the health ministers warning that with the reopening of the borders, there is likely to be a significant increase in COVID cases in Jamaica. How satisfied are you with our health system that it can handle a surge in critical cases? That's question 1. And 2, can you explain the rationale for the cap on funerals and weddings as opposed to what obtains for regular church services?
Let's start with the easier one, which is the cap. The truth is that for regular church service, our view is that there is probably less likely to be the need for personal contact, for consolation, for hugging, close contact discussion. Obviously, for a funeral, you might have the need for consolation, people getting into close contact. And obviously, same for the weddings, if people decide to, congratulate and this kind of thing. I think what I've seen so far with the churches, and I must commend the churches, that they have been very faithful to the orders. They have not breached. I haven't gotten any reports. And so I think we have to commend the churches, and in particular the church leaders. But, we've gotten so many requests and complaints, for marriage and for funerals, that we thought a lifting of or an improvement in the numbers who could attend would assist persons who want to get married. June is the month for weddings, and so we thought we would review it, and I think we have come to a good compromise. As it relates to the risk, I'm appreciative of the question. The government of Jamaica, did not just get up one day and say, we're going to open up the borders. Let's be clear. The professional advice from the CMO and others is that, there will be risks in reopening the borders, and the numbers will rise, and we have been advised on the risk. The government of Jamaica, under the Disaster Risk Management Act, has to take that risk into consideration and put in place the measures to mitigate it. There is no riskless activity in life. And sometimes when I read the commentary and the articles that are written by armchair experts, it is as if the government has a clear pathway with no risk. It is as if the government can keep the economy closed and not have to worry about the farmer in St. Elizabeth or in Westmoreland or in Manchester, by the way, which I saw today at the farmers market, who pointed out to me that they are not able to sell their eggs, sell their vegetables. Many of them have trailer loads of goods that they buy from the small farmers. And what was very sad is when one said to me, Prime Minister, if we don't do something now, then we will likely have a food problem, because the farmers are not going back into the field to plant unless they have an understanding of where their produce will be sold. And somehow we believe that tourism is foreign to Jamaica. Many of our farmers depend on tourism. Over 300,000 Jamaicans, in some way, shape, or form, benefit from tourism in working. So this false notion that the government is making a decision to reopen our economy for an elite group for tourism is the greatest insult to me as a Jamaican and to the 300,000 people who depend on the industry for their survival, that bring in over 50% of our foreign exchange. The same people who are criticizing are the same people criticizing why is our dollar moving. Get real. Let me take off my mask. Sometimes I wonder if the people who are making the commentary really sit and analyze where we are. You know, there is a sense as if, as politicians, we don't have any care for the people. Every day I go out and look the vote of the people. I go to their yard. I get the messages. I get the calls. And none of them have any greater care for the people than I do. And I reject the idea totally that somehow they can pontificate about the care of the people. And none of them go down to the inner cities and experience the suffering and the hurt of the Jamaicans who don't have a job, who are worrying where will their next meal come from. So when I say we have to balance lives and livelihood, it's not a task that is mutually exclusive. I do one and then I can't do the other. We have to do both. And I believe we have struck a compromise that can work. It is not a blind compromise. We have sat and analyzed the risk. And I'm not hiding anything from the Jamaican people. I've projected it there to tell you what the risk is likely to be. We have gone through an intensive process of managing the re-entry of Jamaicans into the country, 2,300 of them. And we have, after testing 2,300, we have identified 54 cases. That gives us an idea of what to expect if you were to bring in other numbers. And we are planning to bring in the numbers of Jamaicans that have applied on the Jamaican Gov't app. And you know, the discussion comes again about testing every Jamaican that comes in and everyone that comes in. Somehow we forget that between the 18th and the 24th of March, 7,000 Jamaicans came in, untested, unquarantined. We couldn't find them, we didn't know where they were. And we had to go on a very intense public education campaign to get them to follow the rules, follow the orders, stay at home. I dispatched the Commissioner of Police to try and find them. The addresses that they gave were incorrect, many of them, we couldn't find them. But luckily, the good conscience of Jamaicans, many of them registered on the app. So I trust my Jamaican people. So there are those who pretend that they are, defenders of the faith and the people. Who, if it were up to them, I wonder what would be the management of the epidemic. Well, we know how they managed epidemics in the past. And we have managed this epidemic in such a way that Jamaicans overseas and other people overseas want to come back home. And we are going to continue to manage it in a safe way. We have brought home almost all our cruise ship workers now. A few glitches, logistics issues, resource-stretched issues, but we have brought them home. And now we are turning our attention to bringing home the over 7,000 Jamaicans that have registered. And I'm certain that after today's press conference, another 3,000 or 4,000 or 5,000 will register, in addition to non-Jamaicans who live here, and then there might be a few tourists who will come. Because the conversation has just been swamped out, as if to say that as of June 15th, we will see 100,000 tourists coming onto the island. What world do you live in? What we are doing is preparing for the reopening of our economy, to give the farmers hope that they can now start to go back into the field, to start to plant. Because many of them saying, well, if we don't get a date, then why would I go out and plant? And it's the same thing. They're saying, bring back the Jamaicans, but don't give a date for the reopening. You believe Jamaica has any aircraft parked somewhere that we can just fly as we want and go and pick up the Jamaicans? You believe airline companies just sit there waiting on us? They have schedules and itineraries, and they need to have a date so that they can plan. Some require it months in advance. So we had to declare a date so the mobilization and the logistics can be in place to move the very Jamaicans you're asking to be brought in so that the flights can be there. Right now, it is a challenge because some airlines are going to other countries. They have shifted their schedule down because, you know, we wanted to make sure we have everything in place. So there are no easy pathways in this management. And I would, you know, I'm not someone who is afraid of criticism. But I don't like people who make false criticisms. That's not, in this epidemic, necessary. And for good reason. Because it confuses the narrative and the conversation. And it takes up my time that I have to be using to make sure we get the protocols right, to spend trying to out all kinds of fires, because people who should know better keep coming to say, why this and why that? And the distraction and confusion. And that is probably the, you know, the panic in pandemic. But I believe, as I've said before, we have managed it appropriately. And I just had to take this opportunity, thank you for the question, to explain to the public that, you know, this is not a fly-by-night government, or a government that does not have leadership and control and deep understanding of the issues. The hours that I spend informing myself, not through social media, not through Facebook and reading all kinds of articles that turn up, but by consulting with people who are professionals, by reading some of the academic articles and asking the pertinent questions so that we can make the right decisions. And we will continue to do so in the interest of the people of Jamaica, not some, but all the people of Jamaica. We will recover from the pandemic and we will recover from the recession.
Yes, Prime Minister. I want to move on to the third question, but just to be clear, you're saying
I gave you everything.
No. The question was, how satisfied are you?
Oh, yes. So we made the decision. Right. Sorry. Yes. So yes. Other part now, and I promise you I'll be short with it. So we made the decision to move to the accelerated repatriation when we saw that the beds being utilized were low, that the number of persons in critical care or having serious to critical illnesses were low. And I think we are at that point now. So if, based upon our projection, if we continue as we are, and then we bring in Jamaicans, we are expecting that there could be as much as 250 additional cases. A percentage of that would require critical care, and therefore we would have the capacity to treat with that. And that is why we have made the decision. We would not have made the decision if our recoveries were not now accelerating. And that is why we say, okay, now is the time that you could take the risk. Because make no mistake, we are taking a risk in bringing home our Jamaicans. But we have, you know, I want to bring them home. It is their constitutional right to be here, and we have to bring them home and manage the risk. As you said that, I think I must say it to those who are listening overseas. When you come home and you see your grandmother or your uncle with diabetes, do not go and hug them up. Call them on the phone and say, hey, I'm back in the country, love you, but I can't come see you now. Right? I have to say it that way.
All right, sir, we are at 13 minutes past 8. Let's go then to our final question.
I think Damien is asking.
Well, we have
Yes,
one other
I have
person.
a third question.
All right,
I
real
did
quickly,
indicate
Damon,
I'd
and then
like
we
to
try
have-
and squeeze another person in, please.
Okay, so Prime Minister, how do you measure your effort to improve the prison conditions since you rejected that offer by the British to help in building a new facility?
Well, just to be clear, I was not the government at the time when the offer was rejected, just to be clear. There is a proposal on the table, and we are examining that proposal. I can't say much more because it is just a proposal about a new prison. And what has happened here, as you know, when I saw the pictures, I was embarrassed as a Jamaican. And the more I've gotten, I've seen the report that Minister Chang, the draft report's not finalized yet. Hopefully you can finalize it for Monday. And some of the circumstances in the report, I believe the government can do a little better, and we will. I will spend some time on it to make sure that the conditions of those who remain are improved. As I said, we had started this process of putting in place the budget to improve some of the buildings and I think we had buildings in GP and Tambourine Farm. But we have done some cuts, so those might not come off this year. But we'll see. We'll examine it and see what we can do.
All right, thank you, sir. Let's go to our final person then to ask a question, Ms. Dion Jackson-Miller. I'm sorry, can you unmute your mic? Okay, wonderful, we're hearing you now.
My mic is unmuted.
Go ahead.
Thank you so much. Mr. Prime Minister, may I just say though, sir, that we value these press briefings, but at every single briefing, our questions are rushed and we are not able to question the material you've provided us with. May I very respectfully ask that the ratio be revisited in terms of the questions and the time we have for questions
I tell you what,
in relation to the length of the press conference.
I tell you what, Dion, you know, the next time we do the press conference, we should have less material to present because, and it goes to the point that there are so many things that are, yes, within the environment, which affects mood, which then affects the government, and it diverts our time. And so we have to make sure that when we do these press conferences, we address the information, much of which is misinformation, in the public domain to correct things that, misconcepts, make it correct, and that takes a lot of time. But next week, I'm expecting that we won't have this, extensive presentation and therefore more time for questions, to your point.
I appreciate that, sir. Thank you so much. All right, my first question has to do with the prison system. I spoke earlier this evening with the head of the Psychiatric Association, Dr. Earl Wright, who said there's a post in the correctional services that has been vacant for 20 years because no psychiatrist is going to apply for a post at the level at which it's at, and successive administrations have ignored recommendations to upgrade it. Hugh Faulkner of the Legal Aid Council estimates that about 6 or more psychiatrists are needed in the system. So this is one of the things that's going to come out of your audit. It's been a long-standing problem. Is the government now actually prepared to create appropriate posts and hire psychiatrists for the correctional system?
The Minister of National Security, sorry to cut you, the Minister of National Security told me something similar. I am not thoroughly briefed on that, so I will ask him to come and address it. Minister of National Security.
Thank you, Prime Minister. We certainly will be examining the entire staffing of the medical staffing for the correctional service as we complete a review of the services now. And that includes the psychiatrist, which is essential. We expect we might need as many as 6 by the time we complete the process, but we will be reviewing the entire staffing, the medical staff.
I'm sorry. Yes, go ahead, Dion. Go ahead.
I'm sorry, has Dr. Chang, he looks like he's not finished?
No, I'm fine.
No, he's awaiting your next question. Go ahead.
Oh, okay. My next question isn't for Dr. Chang. It's having listened to the protocols, the tourism protocols, I'm trying to understand what seems to be. what seems to be a distinction in the way business tourists are being treated as opposed to recreational tourists.
Yes, actually there is a difference, and the difference is that, so the business tourist is someone who well, you know, when you come into the country, you're asked what is your purpose of the visit, and someone who declares that they're here for business, if their stay is less than the incubation period of 14 days, then what will happen is that they will be tested on arrival, and then they will quarantine at their hotel or wherever it is that they declare that they are staying. And the quarantine means they can't leave until they get their results, which we expect to be a turnaround time of 24 hours. If their result is positive, then they now fall under the control of the Ministry of Health, as would be the guidelines of PAHO and WHO for persons who have the disease. If their results are negative, then they can go about their business, and then of course they would have to leave the country within the time allotted for their stay. For a person who is traveling for vacation, as you've put it, the Minister of Tourism has defined the COVID-19 resilient corridor, and that corridor will be under a stay-in zone order. So tourists who come, the truth is, you know, we have criticized our and I'm just going to criticize our tourism industry for being all-inclusive. You know, and in many ways, you know, there are things to be improved with the all-inclusive model. But I think in this instance, it can serve us well. In this instance, it can serve us well. And we have to utilize that if that is part of the structure of our tourism to get out of this recession and get out of this crisis. As it turns out, most of our resorts are on the coast, and you can actually, you know, properly declare a corridor and have it properly managed with separate protocols. So the tourists will be in that COVID-resilient COVID-resilient corridor. Well, we hope you can make it resistant. So they will be in that stay-in zone corridor.
So if I understand you correctly, that's the rationale that we're expecting that the recreational tourists will adhere to what they're told and stay within this imaginary corridor?
Well, remember the nature of coming. So what remember now, the tourists who would be coming would be booking through an agent, and they are being placed in a resort. And the resorts usually have the duty of securing their guests, and I'm sure the protocols are established to say this would be the basis on which the travel is done. And in any event, you know, the World Tourism Organization, the protocols there and the standards there is that the tourists must respect the rules and regulations of the country in which they are vacationing. And that is standard, and we expect that.
Thank you very much.
Thank you, Dion.
Thank you so much, Mr. Prime Minister. Thank you so much to our media partners for joining us, and thank you too to members of the public, ladies and gentlemen on social media, for this another briefing by Prime Minister, the Most Honorable Andrew Holness. Join us again sometime in the future for another briefing. Until then, have a very good evening and certainly enjoy the rest of your weekend. Good night.
Hi there, I'm Simon Preston from TVJ. Thank you very much for watching our YouTube channel. To see our latest videos and also to see live events, click here. To see our full videos on onespotmedia.com, click here. Thank you very much.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please